Hi, Jackie Van Ruller here, and in today's video I'm going to be talking about diverticulosis and diverticulitis. So these are conditions that are associated with bowel issues, and what happens is that you tend to get these pouches in your ascending or sigmoid colon, and they tend to expand, and you can get things stuck in them that cause some lower abdominal pain. In general, most of the time you're going to feel the lower abdominal pain on your left-hand side, but you can also feel it on your right-hand side, and either way can be diverticulosis. Diverticulosis is just an expanding of the colon where you get these pouches, the colon becomes weak, and you might get things stuck in there like seeds or coffee can exacerbate it or things like that. Diverticulitis is just a step further where you've actually developed a infection in there, and that'll be characterized by higher white blood cell count, and in that case your doctor will probably prescribe antibiotics. However, you can avoid diverticulitis and diverticulosis, and part of avoiding that is actually not necessarily listening to the common mainstream narrative about these diseases. The common mainstream narrative will often say that it's assumed that these conditions are caused by a low fiber diet. I would actually say that a high fiber diet is probably more likely to cause this. And the reason is because high fiber is also correlated with a higher amount of carbohydrate intake. And your microbiome, or the bacteria in your gut, will feed and overproduce on a high carbohydrate diet. So you actually want a lower carbohydrate diet that's going to allow that microbiome to become healthier and less dependent on sugars. If you have been on a high sugar or high carbohydrate diet and then you suddenly stop, all these bacteria that are in your gut are going to communicate with your brain that they're starving, and you're going to get these immense sugar cravings. And these sugar cravings are trying to tell your brain that they're starving and they need sugar. And so you're going to have this incredible need to want to eat something high in carbohydrates. But if you work through that for a few days, eventually those high carbohydrate craving bacteria are going to die off, and you're going to get a normal gut bacteria. You're going to be less likely to have things like diverticulosis, diverticulitis, even things like irritable bowel, Crohn's disease, and all the other gut diseases that occur. So incidentally, the two areas where you're going to find things that show up on your face with diverticulitis and diverticulosis are right here. On the right-hand side, this is going to be associated with the ascending colon, the appendix, and the ileocecal valve. So what happens with the ileocecal valve is that's a little valve that is between the small intestine and the large intestine, and its job is to keep the large intestine bacteria out of the small intestine. So you don't want that large intestine bacteria filtering in to the small intestine. On the other side, this is where the descending colon kind of turns and narrows into the sigmoid colon. Generally, with diverticulitis or diverticulosis, most people are going to feel it on the left-hand side. They're going to have this intense abdominal pain or cramping on that lower left side of their abdomen. So let's go ahead and get to work and show you some things you can do with reflexology to keep this condition at bay. And just know that it's also going to be very, very helpful to limit that carbohydrate intake so that you can filter out those bad bacteria, the bacteria that lives on sugar. A lot of times that's like candida and yeast-loving bacteria. And you want to work on getting that really nice, healthy gut bacteria that's going to keep your digestive system flowing. So we're going to start up here with one point that's going to be, so take your forehead halfway between your hairline and your middle of your forehead, and then go up about halfway. This is a point for the large intestine. So you might notice that you have some lumpiness or bumpiness around this area if you are prone to diverticulitis. So go ahead and work that area. And then we're going to come down halfway down and work the point for the mind. Knowing that when our bacteria is revolting and saying it wants glucose, it wants some sugar, you're going to feel that in your mind. And you want to be able to shut those intense cravings off. So this is one of the points you can use for that. Then from this point, we're going to go straight over to about 2/3 across our brow. And we'll feel this point 124. So this is a point for just relaxing the nervous system, relaxing the mind, a point that's really great for cravings as well. So if you're developing cravings, you can go ahead and turn that off. One of the things that can really contribute to diverticulitis or trigger an attack is coffee. And I know that for me, coffee is a huge, addictive substance. I love it. And I've tried to go without it, and my body's like, nope, I want it. And even though I don't use sugar with my coffee, I found that when I don't drink it, I definitely feel better in my gut. Let's go ahead and work that. And then a paired point with that is this point right here on the inner part of the brow. So remember to take some deep breaths as you're doing this. Work nice and slowly. And this point is a paired point with 124, and it helps to just create a deeper relaxation effect, help to turn off those cravings, and also reduce pain. So if you're finding that you're having some pain and cramping, this can be a good spot for just reducing that pain. Then we're going to come down on the nose, and right in front of the nasal bones, we're going to work up and down. This is a point to help increase endorphins. So if you're having pain, endorphins can reduce that pain by producing these pleasant, feel-good feelings in your body. Also opens up your nasal passageways, allowing you to get more oxygen into your body. Oxygenation is always a really great thing for reducing pain. Then we're going to come to the right side of our face, in line with the bottom of our nose, directly under the iris of the eye. We have the liver. The liver is an important point for regulating blood sugar and glucose levels in your body. And then as we go to the other side of the face, we're going to work our spleen and stomach. So the spleen is the organ that controls all of digestion, so that's going to be in line with the flare of the nose, directly underneath the iris of the eye. The spleen is also really important for providing that musculature and the energy to your gut. So basically, diverticulitis is like a herniation of the large intestine. So the spleen's job is to increase the strength and the support of those intestinal walls. So if your spleen's not getting enough energy, it can't do that, and you can get those pockets that produce that pain and those symptoms of the diverticulitis. Coming down underneath the nose and across the smile line is the stomach. Stomach is also really important for nutrients to your muscles, keeping your muscles strong and supportive, and so we're going to work both of those areas. Now, I've had a couple clients with diverticulitis, and what I found is that when they do the facial reflexology on a daily basis, it really helps to keep their diverticulitis symptoms at bay. I've worked on a couple people who have just recently experienced some pretty intense diverticulitis episodes, and honestly, you can see a huge difference in not just how they look, but they feel a lot better, and you can even see more color in their face following a treatment. I had one guy who was literally had just been to the hospital for diverticulitis the night before I saw him. His face was gray and ashy, and he just looked like death warmed over. We did this facial reflexology on him for just, literally was maybe 15-20 minutes, and he you can see his whole attitude changed. His face was colorful, it was bright, you could see that he had more life in him. And so really don't underestimate how powerful this work is. Another client of mine would tend to get a monthly diverticulitis episode. Once we started facial reflexology, as long as she was coming in once a month and then doing her facial reflexology at home, she was able to keep that in bay and not have any episodes. So definitely, if you are experiencing this or somebody else is, please, please, please pass this along. This might be something that saves them a shit ton of money, as well as time and pain and all those other things that happen when you are experiencing health crises like these. All right, next we're going to work from the right side of the chin all the way up and around. And this is following the direction of the colon. But not only are we working the whole colon, up here we're working some really great points for reducing blood sugar craving. So these are for the pancreas. We're going to be working the points to improve intestinal motility and through here. And then these are the specific points that you're really going to want to work and focus on. So starting here on the right side of the face, we have the points for the appendix and the ileocecal valve, and then starting on the ascending colon. So if when you experience your symptoms, you experience it in that right lower abdominal area, this is the area that you're going to want to focus on. Working your way up, taking your time, noticing what you feel. If you have symptoms, you're probably going to feel quite a bit in here. You're looking for lumpiness, bumpiness, tenderness, areas that get more red, areas that feel uncomfortable, or feel like, oh, that just feels so good to work. So just covering this whole area. Now, if you are pregnant, please avoid this area. And the reason for that is because there's a point right here called the ejection point that could possibly trigger contractions, and we don't want to do that if you're pregnant. If you're pregnant, focus more on this whole area of the forehead right in here. In all these areas. If diverticulitis or diverticulosis is something that you're experiencing on a regular basis or have experienced in the past, I would highly recommend doing this up to twice a day. You can do it up to 4 times, so don't feel like you can only do it twice. But I would probably focus on doing it twice a day until your symptoms are much, much, much better. Okay, and then as you're coming down here, make sure you get this area right beside the chin. This part on the left-hand side is probably going to be the area that's going to be the most affected for most people who have diverticulosis. When I was experiencing irritable bowel syndrome, and I would get a lot of symptoms also where I'd get like that lower abdominal pain, these 2 areas were like dry like sandpaper. Like I'd literally touch them, and no matter how much moisturizer I put on, I could not get them to not be dry. Once I started doing reflexology and improved my diet and had less stress in my life, those areas have gone away, and they don't have that those dry patches anymore. Making sure you cover this whole chin area. This is going to be where the colon comes out into the rectum, and so working this whole area as well. And this might be something that you want to just go around the mouth twice. In fact, if you have any symptoms, I would definitely be doing this. This will also help with some bloating, some uncomfortableness, cramping, pain, better bowel movements, less sugar cravings. So other things in your diet that you're going to want to avoid are going to be things like nuts, seeds, anything that can get stuck and irritated in those pouches. Coffee for sure. Coffee tends to irritate the gut. And then of course anything high in sugar. A lot of times they'll tell you to drink fruit juices or things like that, but those things are almost pure sugar. And they're actually going to do probably worse for you than just drinking water or something like that. All right, I hope this helps. If you have anybody who's experiencing gut issues, particularly diverticulosis, have them try this. Have them do this every day for at least a month and see if they notice that their symptoms improve. I think they're going to notice a huge, huge, huge difference. So as always, thanks for watching. If you're not already subscribed to my email, make sure you're doing that so you get these face maps delivered right to your inbox. These are really nice to have printed out so that anytime something comes up, you can refer to that face map and know which areas of your face to work. This is an incredible tool for decreasing stress, decreasing disease in your body, and helping you to feel better emotionally as well. So if you need to pick up your magic wand, head over to my website, JackieVanWiller.com, and make sure you get yours today. Thanks for watching.